Good afternoon, viewers. Welcome, and you're watching Strike News 9. I am Don Cheryl Fletcher, and on today's panel we have Tyler Taylor, a community activist, Akeelia Ellis, a public health specialist, Maria Williams, a women's rights activist, and Tisha Fisher, a local medical doctor. To begin our segment, we will have Tyler Taylor give us a brief overview of what health disparities is.
Quick overview on health disparities. The term health disparities refer to population-specific differences in presence of disease, health outcomes, quality of healthcare, and access to healthcare services that exist across racial and ethnic groups. Disparities represent a lack of efficiency within the healthcare system and therefore account for unnecessary costs. Many factors contribute to racial, ethnic, and socioeconomic health disparities, including inadequate care of access, poor quality of care, community features such as poverty and violence, and personal behaviors. These factors are often associated with underserved racial and ethnic minority groups, individuals who have experienced economic obstacles, those with disabilities, and individuals living within medically underserved communities. Consequently, individuals living in both urban and rural areas may experience health disparities. Despite ongoing efforts to reduce health disparities in the United States, racial and ethnic disparities in both health and healthcare persist. Even when income and health insurances and access to care are accounted for, disparities still remain. Low performance on a range of health indicators such as infant mortality, life expectancy, prevalence of chronic disease, and insurance coverages reveal differences between racial and ethnic minorities populations and their white counterparts.
Thank you, Tyler, for that quick overview. Next, we have breaking news with Akeelia.
After a long couple of months, both the Senate and the House of Representatives have passed the Affordable Care Act, granting the citizens of this country access to affordable health care no matter what their income level is. This new act permits children who are married, not living with their parents, attending school, not financially dependent on their parents, and eligible to enroll in their employer's plan to remain or join their parents' plan until the age of 26. With this law, there are more options to live a healthier life due to no cost at preventative care. With no cost, some families have the opportunity to get blood pressure, diabetes, cholesterol tests, cancer screenings such as mammograms and colonoscopies, also counseling on quitting smoking, losing weight, eating healthy, and even depression. One of the most important new aspects is insurance companies can no longer deny people with past or current health complications. Health disparities refers to imbalance within health statuses of various groups of people. This leads to different types of care and quality care based on how the individual identifies themselves. Health disparities can result from numerous factors such as poverty, environmental threats, inadequate access, individual behavior factors, or even educational inequalities in income. While the government is trying to make the country a healthier place, the new ACA is important to fix the root of why people become unhealthy to begin with.
Thank you, Akeelia. Next, we have Maria. She will talk about the Zubik versus Burwell case.
Good afternoon. So today I will be discussing the case of Zubik versus Burwell. In 2010, Congress passed the Affordable Care Act, which requires group health plans and health insurance companies to provide preventative care, including contraceptive coverage for women. The petitioners of this case, Zubik, are religious organizations in which argue that the contraceptive coverage mandate of the ACA violates the Religious Freedom Restoration Act. This act bars the government, and in this case, religious organizations, from imposing a substantial burden on the exercise of religious beliefs. Zubik does not want to include contraceptive coverage in insurance care because they feel like women who choose this method of prevention should have to pay for it themselves. Making women pay for their contraception just because you disagree with their choice can result in inadequate health care. On the opposing side, Burwell discusses how religious organizations should not impose their beliefs on their employees. Doing so can violate the Declaration of Independence, which states all men are created equal. Denying women because they choose this type of method is not ensuring equality for all, which directly relates to health disparities.
Let's move on to Tisha, who will be covering cost, quality, and access of healthcare. In other words, the Iron Triangle.
Okay, good afternoon, everyone. Today I'll touch on how health disparities directly affect the Iron Triangle. The Iron Triangle consists of three key components: access, quality, and cost. Access is individuals of the lower and middle class not having access to healthcare, while quality is the degree of excellence. So, are the services given by the doctor or physician the best? And cost is when individuals can't afford health care, which will cause them to be more prone to diseases and infections. Health disparities directly affects the Iron Triangle because the majority of people without health care are denied due to race, gender, social class, or having a pre-existing condition. Lowering the cost of healthcare would directly affect the quality because more individuals would have access to healthcare. On the other hand, with access increasing, the cost will rise. However, the quality will decrease drastically.
Before we wrap up our discussion on health disparities, I have a few questions for you guys. Tyler, what is the status of health disparities today?
Many groups are still at disproportionate at risk of being uninsured, lacking access to care, and experiencing worse healthcare outcomes, including people of color and low-income individuals. Hispanics, blacks, Indians, natives, and low-income individuals are more likely to be underinsured opposed to whites and those with higher incomes. Lower income individuals and people of color also increase barriers to access care, receive poorer quality of care, and experience worse health outcomes.
Okay. Akeelia, how does the ACA affect the current health disparity issues in America?
Well, since the ACA gives people who are on the poverty line, have environmental threats under the age of 26, and who have previous health complications the access to better health care, this leads to it being more likely that many individuals will seek the medical attention that they need. It is important that everyone has the access to quality care in America, no matter how low or high your income is.
All right, Maria, how does the Zubik and Burwell case affect women's health?
Well, the cost of birth control is already an issue, especially with women earning less annually wages than men. This means they simply cannot afford the contraceptive coverage. Like mentioned earlier, lower income individuals face barriers to accessing healthcare. If women cannot afford to pay these out of pocket expenses, they will forego the birth control altogether. This could lead to an increase in pregnancy rates, thus leading to an increase of the poverty level. If women cannot afford these expenses, how can they afford to raise a child? In closing, women are not the only people affected by this matter. So is the LGBTQ community as well. But that's an issue for another day.
You do have a point there. Tisha, give me two solutions that will help improve health disparities as it relates to the Iron Triangle.
First, I believe reforming our healthcare delivery system to improve the quality and value of care is essential to addressing the escalating costs, poor quality, and increasing the numbers of Americans without health insurance coverage. Reforms should improve access to the right care at the right time in the right setting. They should keep people healthy and prevent common avoidable complications of illnesses to the greatest extent possible. And secondly, the lack of alignment of key measures between public and private sector quality improvement efforts. I think the quality of healthcare could be managed by improving physician and client relationships. If more physicians cared about the well-being of patients, the quality of care given to each individual patient, and commit to improving their overall outlook on the quality of healthcare, the quality of healthcare would drastically increase. However, physicians can't fully take the blame for the lack of quality in healthcare. If you can't measure the quality of care, it can never be improved.
As we begin to wrap things up, let's just get a gist of what we have heard from each of our guests. As Tyler stated, health disparities are preventable differences in the burden of disease, injury, violence, or opportunity to achieve optimal health that are experienced by socially disadvantaged populations. By getting that brief overview, we got to see how health disparities relate to a few topics we talked about in class. Akeelia spoke about the ACA and how the quality of healthcare for minorities need to be improved. Maria spoke about women and their access to preventable care such as contraceptive coverage. And Tisha touched on the Iron Triangle and how many people are denied coverage due to their race, gender, or pre-existing conditions. So I would like to thank all of my guests on today's panel for joining me today to inform our viewers about the different health disparities we encounter in our society. Once again, thank you, and catch us next time on Strike News 9.